My name is Chelal. I work for Bear Care Center. I'm the vice chair to the Baringo CSO network, that is BACSOF, and I'm here to you to present some of the issues that we found in water. And I'm glad that the CEC and the CEO are present today so that we can deliberate on how to improve access to water in Baringo County. Remember, the clarion call of this government is access to water much bay. So we need to look at how far we since we've coming into place, borrowing actually from what we committed ourselves in the CIDP. These are organizations that are in the thematic group of water. There's ZGG, there's Bear Care, there's Action Aid, and there's Child Fund. So these are the issues that we committed ourselves in the CIDP 2018-2022. The pillar for that department is to improve access to clean, safe and adequate drinking water for the residents of Baringo County. And just like I said earlier, is that this access to water much bay, that is the clarion call. We committed ourselves to do the following to improve on the same. One, we were to improve and expand 930 water supply schemes. We were also to distribute 125 rainwater harvesting structures across the county. We were to build and equip 39 poles. These are commitments in the CIDP. We were to develop 19 irrigation schemes, and then we were to construct 71 burn dams. In the KNBS 2019 census, it was established that 34.7% of Baringo residents have access to improved sources of water. These sources of water are boreholes, tapped water, protected spring, and water harvesting mechanisms. So, but again, this is a survey done on 2016. It is Kenya Integrated Households Budget Survey. By then, it was saying it is at 31, access to water in Baringo County is at 31%. So there's slight improvement of 4%. We feel like also there's been prioritization of water projects by the citizens. So there's a lot of activities happening on boreholes, on burn dams, and rainwater harvesting mechanisms. So there's prioritization by the citizens. Apart from access, there's also equity. We felt like what is being said about equity. SDG goal number 6 to ensure that availability of sustained water and sanitation for all. And this is our target for 2030 medium term plan. This is for the national target is at 63% by 2022. On our last implementation report, there was an increase of 12%. That is the fourth quarter report for 2019-20. So there's an increase of 12% in terms of absorption. So it's at 50% currently, as per the last report. But nonetheless, there are issues that affects absorption, and we've written here. One of them is, of course, acute shortage of technical staff. The water department is understaffed, and so leading to slowdown in implementation of projects. Another issue is that there's low allocation to operational maintenance. Some of the balls breaks down along the way, but the department doesn't have money to rehabilitate those balls. When we are doing budgeting, we don't do budgeting for operations and maintenance of balls. Of course, there's low allocation to projects at the public participation level. The community here will say we are allocating 2 million for a ball, but to drill and equip a ball would be more than 2 million. So that is also another issue. The ward development funds are still distributed equally, and so we feel like the issue of wards that have close access or higher percentage of access to water are still getting the same amount like the ones that have low access. So look like, let's say Lembus Queen. In Lembus Queen, they get 25 million. In Trioko, they get 25 million. In Lembus Queen, water access is at 8%. In Trioko, water access is at 5%. So meaning, when the people of Lembus decide to do public participation, they will distribute the resources like equally. So you found that this 10 million, Lembus Queen is distributing 10 million to water. The Yoko ward is allocating 10 million to water. And I've already said the access. This one is at 85%, this one is at 5%. So the disparities will still remain. Also, the last point on the same is most of the flagship projects. In fact, these projects are mainly the national. They are being put on areas where there's a lot of access to water. Look at Chemususu, look at Karanlich. This project should go to the far flung areas where access to water is still very low. To cure the issue of low allocation, we'll be able to develop a cost reference tool. This tool seeks to be used in public participation forums so that the citizens can know that if they want a ball, they should allocate this amount of money, the minimum amount of money. That is something we've developed with the department. We've been able to initiate equity discussions within the executive and within also the county assembly. Even now, this is an opportunity for us, like Evan said, to have a discussion along equity. We'll be able to do some social audits. I think the department are aware of this because we've shared with them the findings of the social audit. Together we'll work this journey to see that this increase of budgetary allocations for operations and maintenance in the water sector. Of course, working together with the sectors and also involving the community to allocate for operations and maintenance. We pray that the county government employs additional technical staff to support the water sector. We also work together to see that this prioritized reallocation to incomplete or stalled projects. You find that community A has ball, community B has ball, community C has ball. So we feel like we should, before doing another ball, we should equip the previous balls. Of course, the cost reference tool, we seeking that the department to adopt so that can be used in public participations. Especially going on now, we are at CFSP now, but likely we'll be at cost at the budget estimates. So this is something that we can use at the budget estimates. Of course, there's been low levels of or absence of technical staff at the public participation forums. That is why community A will say we want a tank to be built. But there's a case, of course, maybe the department are aware of Katoria, where communities say that they wanted a tank. But when the department came in, they found out that it was impossible to construct a tank where the community wanted. So if the technical persons from the department were there in the public participations, then this could not have happened. There's the county water management policy. We feel like it should be fast-tracked. This will also seek to cure the issue of projects that are in communities as told. You find community A, they have a running water project, but there is mismanagement of the water project. So issues around formation of maybe rural water companies and other issues of water management policy should be factored in.